Hi there, my name is Cassandra Sampson and I am a registered dietitian nutritionist. Congratulations on your surgery. You have made it through all of the pre-surgery requirements. You have met with several people, completed several classes and several appointments. But most of all, you have gotten through one of the most anticipated parts of the surgery, the pre-op liquid diet. So now that you're on the other side of surgery, there are three main priorities. That's going to be hydration, protein, and your vitamin supplements. So let's talk about water. Dehydration is the number one cause for readmission back to the hospital after bariatric surgery. It's going to take time to get there, but aim for 64 to 96 ounces of water after surgery. That is the equivalent of 4 to 6 water bottles a day. You can count anything that is not caffeinated, not carbonated, and under 15 calories per serving. You are going to be back on a full liquid diet after surgery. It's the same diet as pre-op, but post-op, there's a different reason that you have to be on it. Post-op, we are looking for hydration. We're looking to prevent stomach irritants. We are prioritizing protein for healing and aiding in the digestion process. So think of it as helping your body break down, absorb, and digest while your body is kind of under construction and healing from the surgery. So there are a few things to pay very, very close attention to. Water and sugar-free electrolyte replacement come first when you are discharged from the hospital. Protein is second, as it is essential to your healing. It's essential for muscle maintenance and energy. Resume drinking your protein shakes on day 2 of discharge from the hospital after surgery. Just be aware that taste changes are very common, so it's important to have a big variety of liquids to choose from. If you're feeling nauseous, it's okay. Take your medication that has been prescribed for nausea. Remember that your pace of drinking and eating, when you get to that point in your diet, could be triggering the nausea. Also, room temperature liquids have been shown to be better tolerated than iced cold beverages. Are your protein shakes tasting too sweet? Take advantage of adding an unflavored protein powder to a flavorful broth, soup, or low sodium, low fat cream soup. Protein shots are also a helpful idea. These are 2.5 ounces of basically protein water, but it provides you with 26 to 30 grams of protein. These shots can be purchased from bariatricpal.com, but remember, you don't take it like a shot, you still sip it very slowly, but there is less volume for the same amount of protein in a typical protein shake. So I mentioned this just a second ago, but your pace of eating is incredibly important. Drink very slowly. Chew your foods very thoroughly once you get to the point of chewing. Hopefully you've been practicing this prior to surgery. Take small sips of your sugar-free, non-carbonated liquids, but make sure not to drink with your meals. If you're experiencing pain during eating or after eating, it is almost always a result of eating or drinking too fast and too much. Your feeling of fullness may be a completely different sensation compared to pre-op. Learn to redefine your comfortable feeling of fullness and pay very close attention to what your body is telling you about fullness. The goal for protein is still 80 grams a day. You won't be able to meet this goal immediately after surgery, but it will be a goal you will strive for day by day, and you'll get there. Protein helps you heal after surgery. It helps support muscle maintenance when you're losing weight very quickly. Muscle maintenance is incredibly important for supporting your metabolism. These are all the reasons why protein is one of the highest priorities after surgery. Always choose protein first in order to get close to that goal of at least 80 grams a day. In the beginning, many of these grams are going to come from liquid sources such as protein shakes and adding protein powders to soups and to water. However, in the future, the goal will be to get the majority of your grams of protein from whole food sources, such as a dense piece of grilled chicken breast, such as scrambled eggs, low-fat dairy sources, nuts, and seeds.